Hey there, Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare, and the Healthitude Academy. This is a video following up on an article I just wrote, Healthcare Coverage and How to Maximize. This is primarily addressing those of us that have insurance by our employer or even our businesses. And, if you're a business owner and you're looking at healthcare coverage, I really encourage you to look at alternatives. There's a lot of good ways to give that service to your employees as well as yourself, and save you money. And I'm talking about direct primary care and an alternative like a share plan. Yes, there are some share plans that are not as good as some of the newer ones out there. There are a few. There's two share plans that I really like. One of them stands above the other with a few differences, but they're both really great, and both of them can serve your needs if you have someone like me in your corner looking out for you as each step of the way. So how do you maximize your healthcare coverage? You want to review your plan each year. If you have multiple choices with your employer, you really want to look hard and maximize what's best for you and your family. As insurance is becoming more and more expensive, our deductibles are being higher and higher. And even if you choose a plan, or if you're given a plan with no options, and it happens to be a high deductible plan, there are ways to really save, because those premiums are not cheap, and our dollars aren't going as far as they used to in healthcare, and they're paying for less. They're denying a lot more. They're avoiding paying a lot, and it's only that circle is growing and growing. They're changing providers in the middle of the stream, going, hey, we're not, your provider, your healthcare provider could be in network 1 minute, and the next they've dropped it because they're negotiating contracts, and then you're left holding that bag. And depending on how that provider handles that, some of them do really good, and some of them are just like, here's your balance, you owe us, and you're like, well, you're a network. It becomes really tricky. That's why, basically at the end of the day, and some insurances profess that they have advocates and the like, but at the end of the day, they're all out for themselves. They look at things differently than I would look at them. They're looking through their eyes, not through the eyes of correctness. A lot of times they're trained to put blinders on and only see certain things, only go after certain things. Providers is kind of the same way. When I worked for a healthcare system, they put their blinders on. For example, if a patient called and said, hey, I didn't get this drug, even though they got it when they were asleep in the OR, they claim that they don't get it. They'll take that complaint and they'll just look at that drug, and they will defend whether or not that patient got the drug. Now, if they see that there's other things missing, they won't address that. Or if they see that other things are on the bill that shouldn't be, they won't necessarily address that. So that's really sad when the patient, calls and complains about something that, that looks disconcerting on your bill, and that's the response you get. I don't have the ability to do that. My ability is to look at the whole picture and make sure that everything is correct, because my team and I believe wholeheartedly that every bill should be correct, every bill should be looked at, but not by just the payer and just the provider, but by a separate entity that has no ties to either, and just the accuracy. It's kind of like a third party person to make sure that everybody's on the level. That the consumer, because the consumer routinely is the one left holding the bag and left holding the bill and having to pay it. So it would be of everyone's best interest that all the bills are correct, because then you take off what shouldn't be on some bills and put on what should be on other bills. Nothing worse than having a surgery, a major surgery, and the hospital system is set that the bill will drop in 4 days. And if that hospital system isn't capable of going back and catching that bill missing charges, and if the payer that's paying that claim doesn't say, hey, this bill's wrong, we owe you more money, they'll just pay the claim. And while that particular patient won the lottery in the sense of that bill is far less than what it should have been, that's great for them, but at the end of the day, that's where hospitals struggle. And is it their own fault? Yeah, well, maybe, yes, because they don't have systems in place to catch stuff, and they've really gotten good at saying, hey, we're doing really good because we're shoving all these bills out, whether or not they're accurate. So I am a proponent of the bills are correct and as they should be. So, again, the other situation is the in and out of network situation, how doctors may not change as much in and out of network as a big facility might. That can be a problem for you. And I use the example of a recent patient that had, I believe it was Cigna. They had gone to the emergency room to a facility that was in network the year previously, but the year that they showed up at the emergency room, they ended up being out of network, and the hospital did not discount in any shape or form. They are taking that patient to task for the full amount. And I think that's criminal, because if you were a self-pay patient, you would have gotten a better discount. If you were in network, then there would be the contractual amount. And I just feel that it's just a criminal act to go after a patient for a full bill, basically balance billing based on the fact that they're out of network, and not just giving them a discount of opportunity of taking that insurance off the table because it's out of network, and settling more reasonably with the patient. But if that patient has met their deductible, it's really unfortunate. And that's why I despise in and out of network. So there's a lot of factors that we can navigate for you. We can keep you updated to any changes in your providers, let you know where your better facilities are for your providers for that insurance. And there's so many things that can keep you out of healthcare prison and unnecessary expenses. And then there's also the great options for those that don't have good benefits offered to them by their employer. So there's a lot of things to crack into, and as always, we here at Think Healthcare Solutions have those solutions for you and can be there holding your hand every step of the way, along with helping keeping you compliant with your healthcare journey and encouraging you along the way to be successful in your journey in your healthcare and lifestyle changes. So, till next time, take care. See you soon.